Our area's wastewater just revealed a significant jump in local flu cases, but that's not the only infection that's been uncovered. Joining us live with those details is Dr. Amy Lockwood. Dr. Lockwood, thank you for joining us.
Good morning. Thanks for having me.
Now, before we get into your findings, tell us a bit about how wastewater monitoring works and how it is able to show us those different infection rates.
Yeah, wastewater monitoring really became something that we've started to rely on in public health during the COVID-19 pandemic. And what we're able to do is gather just a little bit of wastewater, just a small bottle, and analyze it to see what viruses are circulating in a community. And this is different from what we do with clinical data that requires somebody to go to the doctor and get a diagnostic test. It's just contributing to the wastewater the way we do every day, showering, going to the bathroom, washing our hands, and we're able to see all the viruses that are circulating in a population. It's pretty incredible.
It is, and considering the sample size you showed us there, is this something that's particularly accurate?
It really is. We've been incredibly surprised about how many things we're able to find. And when we did the research to make sure that this was something that worked well, we compared it to the clinical data. And with every single virus that we've looked for, we've seen a really close correlation to that clinical data. And the real proof point for this was once we saw the difference in what was happening with clinical tests in 2022. You might remember when everybody started taking these antigen tests instead of going to the doctor for COVID-19 tests. That's when we saw a difference. And what that meant for us is that the wastewater was telling us what was happening beyond what was happening in testing. And so we've begun to rely on it even more because of that fact.
All right, let's get into the findings in our area. What did this reveal about the flu cases we're seeing?
Yeah, it's been a really tough flu season and respiratory season in general. Some folks have been calling it a quademic because we're seeing both flu, RSV, and COVID-19 peaking. Luckily, we are starting to see a decrease in the wastewater. I think we'll still end up with a bit of a lag where we continue to see cases in flu in clinical studies, but we are beginning to see an abatement. And that's good news for everybody, but we still have to keep our eye on the prize. We're also seeing a very high amount of norovirus. Norovirus is sometimes thought of as the stomach flu, but it's really the keeping your hands clean and making sure that you're not passing along germs to folks when you're shaking hands or hugging. So good news on the respiratory disease front, but still something to keep our eye on for the gastrointestinal diseases.
Yes, I also have a young child, so I feel like I'm always panicked about anything gastrointestinal in the home. Now, when it comes to local numbers versus national numbers, how does our area stand?
You know, the clinical numbers for the state of Washington are still quite high, but we're seeing a drop across the country. Hopefully we'll see that Washington begins to follow that pathway as well. We tend to see some differences from state to state and region to region, and you kind of can't tell exactly how things are going to move. But again, all indications are that we are moving in the right direction as we come into the spring.
Now, we know that, generally, this part of the country does tend to have a better vaccination rate in general compared to other parts of the country. So what would you say is driving the uptick that we're seeing?
You know, it's just been a really rough flu season, and it seems like while the vaccine did give us some coverage, it didn't give us complete coverage. Now, the thing that I don't want people to worry about is the H5N1 infections that we're seeing in poultry and in dairy cattle. That is not something that is driving the high rates of influenza. That is still really restricted to animal populations and not to the human populations. We've seen a few cases, but it's really not driving what's happening with the regular flu epidemic. We often have high flu years, and this just happens to be one where we're seeing quite a bit of infection.
All right, I do appreciate you saying that because, here on the show, we do often talk about how these numbers are changing in that respect to the bird flu. Now, what is it that you want viewers to keep in mind when it comes to attempting to stay as healthy as possible here?
You know, I think the most important thing is for people to stay home if they're sick. If you don't feel well, don't pass that along. There are lots of good things that you can pass along, but a virus isn't one of them. So if you're not feeling well, stay home, and then just take care of yourself and your family. Make sure that you're getting all the liquids that you need, and then wash your hands, because norovirus is something that we need to worry about, and that one takes soap and water to wash your hands and make sure that you're protecting yourself.
Something so simple. So hopefully we can all do more of that. Dr. Amy Lockwood, thank you so much for joining us today.